Welcome everyone. Welcome everyone to our second School of Medicine Town Hall regarding COVID. Last week we were able to enjoy the company of 7,500 of you, and we expect the same today. Last week we were able to put answers to many questions, both pre-submitted and submitted live. And then we will do the same format here today. We have the same panel of distinguished leaders here. My name is Andra Blomkalns. I'm the chair of emergency medicine. We have Yvonne Maldonado, Lloyd Minor, David Entwistle, and Paul King. And Bonnie, why don't you get us started with some opening remarks?
Well, thank you. And again, thank you for joining us. I think you realize that a lot has been said in the media. I think it's all around us now. And what we want to do today is give you some thoughts and answers to the most of your questions. We want to make it clear what we are doing from a medical and an epidemiological and a public health perspective to make sure that all of you are safe, that work here at Stanford Medicine, and that you provide the best possible care for your patients in a safe environment.
Well, thank you. I want to echo Bonnie's comments in thanking you for the amazing work that you're doing. We know you're concerned, and we want to support you in every way that we can. You embody our mission, and we're so thankful that you do, and we're very thankful for your dedication, especially under challenging circumstances. We have launched a website for COVID-19 in order to post the most up-to-date information coming from our experts and also from our frontline staff about how we're responding to this epidemic and the health care that we're delivering. The URL for the website appears on your screen now. We suggest that you bookmark it and that you refer to it often because we'll update it often and make sure that it gives you the most up-to-date information. Also, I want to make a few remarks about personal protective equipment, or PPE, and there'll be several comments about that during this town hall today. I want you to know that today, this morning, we convened a task force to make recommendations on the utilization and allocation of PPE. This task force includes the leaders of many of our clinical departments, as well as frontline faculty and care providers. It also includes staff members, and it includes representatives from the supply chains of both of our hospitals and delivery systems. This task force is going to produce recommendations by tomorrow on how PPE will be utilized. Also, I want to make a few remarks because, unfortunately, there have been a number of hoax emails sent out claiming to come from Stanford Medicine when they actually have had nothing to do with Stanford Medicine. And unfortunately, some of them give misinformation. And in addition to that, in addition to hoax emails and text messages, there have also been people representing themselves as from Stanford Medicine when really they have no affiliation with us. So we suggest you follow the URL, look at the website where we'll make sure that accurate and up-to-date information is posted, and be skeptical of things you see on social media that you may not recognize as coming from us. David?
Thank you, Lloyd. Let me just start with the same thank you. We appreciate the work that you're doing. We know this is an anxious time. We know there's a lot of information that's going out. We know that as individuals are trying to cope with this with their own personal lives, with their families, there's a lot of work that's going on. But I want to say how proud I am to work here. I see on a daily basis incredible work that's going on that, quite frankly, sets the bar for what's happening around the country. And I'm so proud to say that I work at Stanford and to see all the great things that we're doing to care for our community and the patients that we have. We also know, as Lloyd mentioned, there's a lot of information that's out there right now. There's a lot of media sources. There's a lot of pieces that we're seeing, whether it's through our social media accounts, through the news. And we want to make sure that you have the latest information that impacts your work, impacts what you're doing. So this Friday, you'll actually see a new daily briefing, the Stanford COVID Daily, that will actually be coming out to allow you instant access to information and allow you to be able to have an up-to-date source of the most recent pieces. We know there's a lot changing, and with any evolution of the thinking, what's happening even on a nationwide basis, that information changes, and we want you to have the latest. But we appreciate all the great work that you're doing. We're so thankful that you're here. Paul?
Thank you, David. First of all, I want to welcome and thank you for joining us here again today. We realize that there are a lot of questions, and as Andra said, there are 7,500 of you who joined us last time. Many of you are joined us again today. Several of the questions you have we didn't get a chance to get to last time. We're going to be doing these town halls weekly for a period of time, so you'll have plenty of opportunity to continue to contribute to the knowledge that we have as we take this journey together. The website and the URL that David and Lloyd were referencing, that's going to be a place where we post the information that we think is most important for you to have, and the information that has been developed, quite frankly, with your input. For those of you on the Children's Hospital side, we realize that on occasion you feel that we've forgotten you. Believe me, we have not. One of the silver linings around this crisis that we are all dealing with together is that we have come together as a health system better than we have ever before. So many of the things that we're doing, many of the policies that we're pushing out, really are the result of collaborative discussions that have been held across all parts of Stanford Medicine. Those things that are unique to each of our hospitals will be communicated in that fashion. So the website that they mentioned will be segmented between the adult hospital, the children's hospital, Valley Care, our PCHA and UHA partners as well. In addition, on the children's side, we've started a new inbox where you can talk to us, and that'll be COVID, thank you. COVID-19 at stanfordchildrens.org. COVID-19 at stanfordchildrens.org. That's a place you can send us information that you think we need or questions that you feel we have not yet answered. So we look forward to your questions this morning, and thank you for joining us again.
Very good. So it becomes apparent that there's a lot of evidence, quote unquote evidence, and then a lot of things that aren't simply true out on the internet. And as a provider and also a chair, I can tell you that we have experts across all fields, experts in infectious disease, and also connections with the CDC, federal agencies, and otherwise to provide you the best possible advice on the Stanford website. So I ask you to be cautious in terms of looking for interpretations of articles in different ways. We want to get you the best information in one place. We'll get started with your submitted questions. Lloyd, how does the recent shelter-at-home order for the Bay Area counties affect Stanford Medicine operations?
Thank you, Andra. Well, shelter at home does not apply to essential healthcare personnel. It doesn't apply to us when we're involved in performing our duties and activities. It should apply to us when we're not involved in the work environment. It's an important measure to, as has been described, bend the curve on the growth in the number of cases. And in so doing, to allow us and make sure that we can provide the health care to people who are infected with the virus that causes COVID-19. Also, there are some essential personnel on our research side as well, such as those involved in the veterinary service units and some personnel for laboratories, research laboratories. The guidelines governing those activities and essential personnel, the identification of essential personnel, have been put forward and distributed by the Vice Provost for Research, Cam Moeller, and also by leaders in the School of Medicine, Ruth O'Hara and others. And we'd encourage you to consult those guidelines if you fall into the categories covered by research.
Okay, great. Bonnie, can you tell us if the federal guidelines currently are sufficient to help our healthcare workers?
Yes, I think that there's been some questions about how effective are the guidelines that we're receiving from the national at the national level. And I want to assure you that the federal guidelines have been based not only on this particular virus and this particular epidemic, but on the many, many decades of experience that we as public health officials and epidemiologists in this country and around the world have garnered from other experiences and brought them to the table to understand how to deal with this particular epidemic. So these are established guidelines that are really developed to be individualized for an ongoing process. Now, What you will see over time, and what may sometimes provoke a little bit of anxiety, is that, well, last week you said this and this week you said a different thing. And that's because as we learn more about this virus and this epidemic here in the US, which may not act the same way as it did elsewhere, we may adjust our guidelines. But the original guidelines are set up to be as conservative as possible and then try to adapt those as we learn more and can potentially loosen those up. So I have absolute confidence in our ability to use those guidelines for what we're doing here at Stanford Medicine.
Okay. David, are we running out of personal protective equipment for our healthcare providers on the front line?
Thank you for that question. This is certainly something that we're seeing in the national media even today. In fact, you may have seen folks are actually making their own PPE equipment. We are not in that position. We do have a reliable source of our personal protective equipment. The safety of our staff, our clinicians, our faculty is paramount for us to be able to do the work that we're doing. I want to assure you that we are doing all things that we can to make sure we have a reliable source of PPE equipment. I want to give a huge shout out to our supply chain team. They have literally left no stone unturned in terms of what they've done to search for, look, acquire, and be able to have the PPE equipment actually coming into our docks today. So there's a lot of great work that's being done there, and I want the team to know we appreciate their work. At the same time, we know that there's other access to other sources of PPE equipment, whether that is through companies that store this themselves. We have actually approached many of those and had some great work that's being done with that. Also with state and federal resources. And in fact, we've also had good luck with that in terms of being able to work even with our elected officials that have the ability to help steer some of that toward us. I want to make sure that people know that we have the resources that we need. We are following the CDC guidelines in terms of how that gets monitored, how that gets worn. As was mentioned earlier, we also have others that are weighing into that. We want to make sure that people feel comfortable, that they feel safe in their environment and have the equipment that they need. I will tell you, back to information that's going out that actually maybe is not always well intended. We did have a well-meaning person that sent out a message that came from me saying we're desperately needing PPE equipment, that we don't have it. That's not true. Just be careful of what you're seeing. We do have reliable sources of that and continue to receive daily shipments of that as well.
Okay, great. So a lot of things have changed this week. Paul, one of those is that schools have closed. And we have many healthcare providers who now are without childcare. What is Stanford Medicine doing to help our Stanford parents, particularly those on the front line?
Well, thank you, Andra. We know that for you to be at your best in terms of taking care of our patients, you need to make sure and feel confident that your family is taken care of as well. Here at Stanford Medicine, we do have some programs available to you to make sure that you have reliable child care. We assume you're going to reach out to those personal resources that you already have in terms of friends and family, so you don't need our help with that. But when you exhaust those resources, we do have a program through Bright Horizons Backup Care Advantage program that many of you are already familiar with. That's also available to make sure that you have access to child care for your children. The details of that you can reach on that website that we talked about, as well as our intranet. But those are programs that have banks of childcare hours as well as supplemental payments that are available to you as an employee of either hospital or the School of Medicine.
David, this is a pretty serious submitted question. I'm worried that I might soon be unable to work due to the COVID-19 outbreak. Will I still be compensated?
We want you to know that, please, if you are sick, we want to make sure that you're available to care for our patients and do the work that we need to do here at Stanford Medicine. If you're sick, please go to occupational health. Make sure that you're connected with them. I want to assure you that if you are told that you are sick, first of all, we will see, can you work from home? And if you have the ability through your manager to work from home, then that continues as is. If you are not able to work from home but still need to go home, you will be placed on administrative leave and still paid. This will not come out of your extended sick leave banks. This won't come out of your PTO banks. We will actually compensate you for the work that's being done, but we want to make sure that you're doing the right things to be cared for. But if you get sick, we're going to back you up too.
Okay, wonderful, wonderful. Bonnie, if you look on the internet or watch the news, there are a bunch of very scary projections about illness and death. Can you tell us, are these worst case estimates, or how do you interpret those?
Yeah, I think a lot of these are worst case estimates, and I think that's because when you're starting off with a brand new virus, a brand new organism in the world, anywhere in the world, it's very difficult to predict what will happen to it later. So for example, we've seen people superimpose the epidemic curve of Italy and the US and say we're heading in the same direction. I think that may not be quite accurate because we don't really know what the circumstances were in Italy, what the patient populations were, what the interventions were, and all of the risk factors that went into building that epidemic there. We have taken a lot of precautions here in the US and especially in the Bay Area. I know that this shelter at home is very distracting and can cause anxiety, but it is going to keep us from spreading this virus within our communities, and hopefully will keep that epidemic from blossoming out into what we've seen in other parts of the world. So we are trying to be cautiously optimistic about the way we are dealing with this, and we are being very aggressive, especially in California.
Great, great. Paul, what IT resources are available for employees of Stanford Medicine?
Thank you, Andra. We have an amazing team of IT professionals across all of Stanford Medicine through both hospitals as well as the School of Medicine. Over this past period of time, as we've been responding to this crisis, they've stood up our capability and scaled our abilities to take care of our employees who can safely work from home. So that's something that we're very proud of. In addition, we've seen a tenfold increase in our ability to do e-visits. So our IT teams are also enabling us in terms of not only providing our administrative resources from home, but also our clinical resources as well.
Great, great. Lloyd, where are we now with COVID-19 testing?
Well, as we remarked last week, we were one of the first institutions in the country to develop and have the FDA approve our own RT-PCR for detection of the virus that causes COVID-19. And we're testing hundreds of patients every day with that test in our delivery system, as well as we continue to provide the test to a number of other delivery systems in the Bay Area as they bring their testing online. We have plans to scale that up even further, and we have the instrumentation to do the scaling. We're waiting for the reagents and other supplies that will enable us to do that type of scaling. But rest assured, we are testing patients every day. We have a set of criteria that have been developed, and those criteria are enabling us to detect the virus when it's present, and also to reassure people who may have symptoms, but who may not actually have those symptoms be due to the virus.
Thank you. I've been very impressed with how innovative all our providers have been, both from working to adapt to work remotely, as well as some of our outside testing facilities, which look a little bit like NASCAR descending upon an individual, getting the job done and letting them go on their way for their life. So there are a number of very innovative things happening currently at Stanford Medicine. At this point, we're going to get the live questions that you've been submitting, and thank you very much so far for your attention. To all of us, with a stream of bad news rolling in, is there anything to be optimistic about right now?
Let me share one thing. When we talk about digital health, one of the things that we've looked at, even as an organization, is how can we provide more of the care that we provide virtually? And as Paul was just sharing, what is fascinating is to see how much of the work that we're actually doing now can actually be done online. We're seeing very similar in our own, in the adult side. We've gone from less than 2% of our visits in primary care being done virtually to now over 20% of those visits being done virtually. And so it's great to see not only for the protection and safety of our staff and our faculty, but also for the convenience of our patients. And so there's a lot of great things that are going on now. That's exciting to see.
Okay, great. Others?
Let me add that yesterday you may have heard that China reported that they had no cases for the first time. So we know that this will come to an end. Now, whether this virus comes back or not, or whether we see other things in the future, we know that we at Stanford in particular, we have the technology and the amazing minds and the hardworking people like you to really help us take care of these patients. But we do know that this will come to an end, and we will keep everybody as safe and healthy as possible until that happens.
Wonderful, wonderful.
One thing that makes me optimistic is our people. In fact, that's the main thing that I think makes all of us optimistic. We work with amazing people every day. And again, we want to thank you for your dedication. We know you're stressed, we know you're concerned, and we want to be able to address those stresses and concerns as best we can. But it's our people that make me optimistic.
Bonnie, what is your best guess of how long we will be sheltering in place and social distancing?
So I think it's going to be hard to know for at least another 2 to 3 weeks what these effects of social distancing will be, because we know the incubation period of this virus can be as long as 2 weeks. So within that 2-week period at least, and maybe beyond that, maybe another week or so, we'll be able to see if we start seeing less cases or if they plateau. And then we'll see what happens at the state and national level around the next steps after that. So we'll know within the next couple weeks.
Bonnie, if you could just comment briefly on the difference between social distancing, self-isolation, and quarantine. I think there's a lot of confusion around those topics.
Yeah, so quarantine actually means that you have been, it's a legal or a public health mandate that, and it's not just used for this, it's actually been used quite often for other individuals, not usually for whole communities, but that is an order that you must not leave a particular area and you're monitored. Self-isolation really means that we are just asking people who are sick to stay home and try to stay away from others as much as possible. And now this issue of shelter at home is really an attempt to scale up the self-isolation so that we can keep as many people apart, so that if a family member has an infection, that family member will take precautions within their home, but then it will also not spread to other families within their own network. And we're hoping that by shutting down that network for a few weeks, that we will let this virus die down.
Okay, great. David, how are we working to obtain more personal protective equipment, and are we accepting donations?
Well, let me tell you, as I shared just a few minutes ago, we are literally looking at all sources, and we're getting a lot of that PPE equipment that's coming in, both whether you look at N95 mask, whether you're looking at gowns, whether you're looking at just reagents that are coming in, as Lloyd talked about for our tests. So those things are coming in. In terms of donations, it's a difficult, we sometimes get some things that are very meaningful and very useful. Sometimes they're not as useful. And so we're being a little bit cautious on some of that we're taking in. But we're looking at all sources that are coming in through our supply chain department. If you have a resource, if there is a donation, or if you've got somebody, please make sure to funnel that to us. We'll be able to say real time whether that's something that we would need and could actually take in as a donation or not. So we don't want to hesitate from folks that are giving sources. We have not got to homemade. I just want to be clear that folks that are on TV that are donating homemade masks and things, and very well meaning, that's not our intent. And certainly, while it's great to see that people are doing that, that's not something that we're accepting as donations right now.
Okay, great. President Trump was just on TV touting chloroquine, an anti-malarial drug, as a possible treatment for COVID-19. Do we know if it's effective?
Well, there are some promising trials that have been done in China in particular around the use of chloroquine, and other countries are talking about using it. It is a drug that we have used for many years to treat malaria, but at this time we don't really have any good evidence here in the U.S. that it is a treatment that we should use. And in fact, we are currently rolling out treatment trials of other antiviral drugs that seem to have very good effects and very few side effects at this time. So more to come, but we're probably not ready to roll out chloroquine to everybody at this point.
Okay, great. Paul, how can we use pediatric providers to care for COVID-19 adult patients?
Actually, I think I'm going to bounce that one over to Bonnie.
Yeah, so I think that has to do with, I think, surge capacity. The pediatric providers, I think, can be placed in, if we needed to surge up, we could readjust our work floor to see where pediatric providers are not being utilized as much as they could be, and maybe put them in places where they can do equivalent work within the adult side of the organization. I also want to take a minute to mention here, because I would be remiss if I didn't. We want our pediatric providers to continue to care for those young children, especially those children under 2 years of age. So those children should still get their vaccinations and their well child checks, especially if you can do some of those by telehealth or other means. But the vaccines, obviously, those need to come in. We don't want to see any other diseases show up at our doorstep because our children are not being cared for. And I know a lot of pediatric providers have been asking that question. The American Academy of Pediatrics is expected to put out some guidelines around that in the next day or two.
And I think we also mentioned your recommendation last week was that if you have not gotten your influenza vaccine, if you can, or if it's still available to do so.
Absolutely.
Okay, great. Lloyd, are residents being told to stay home? Can clinical trials continue?
So residents, by and large, are not being told to stay home. Again, we've talked a lot about today if people are symptomatic, residents, faculty, or staff, then we have occupational health open. Individual programs may have specific requirements or specific determinations about how a resident's clinical activity might be affected as rotations may be shifted as a result of the epidemic, but residents are not being told to stay out of the workplace. Medical students who are on clinical rotations, it was announced earlier this week, for the next 2 weeks are not participating in those clinical rotations. That'll be reevaluated later on after this 2-week period to determine if they come back into the clinical care environment. Clinical trials can and are continuing. There are specific guidelines regarding clinical trials, and again, those have been put out and published and distributed by the Office of the Dean of Research and also by the Senior Associate Dean for Research in the School of Medicine, Ruth O'Hara. So we'd encourage you to refer to specific guidelines regarding clinical trials and whether or not your trial is continuing or not. But by and large, clinical trials, particularly that are treatment trials, there's some clarity around the next steps for those treatment trials.
Okay, great. Compared to other national emergencies our country has faced, how should we be thinking about this pandemic? We got to think about that, right?
Well, I'll let somebody else address the financial issues because I think people are worried about the financial piece. I think I will let David and Lloyd and Paul talk to that, but some of us have lived through the 2008 situation, and I think this is a very different financial scenario. But from the standpoint of this virus, I think we have seen, I don't like to put a scale to this, but this is a relatively mild disease for most people who get it. That is 80% of people who get this disease, to our knowledge, don't have symptoms. And of those who do have symptoms, the vast majority have mild symptoms. We do know that there's risk stratification, so people who are older than 70 years old and maybe and to some degree 60-year-old as well, have a higher risk for getting more serious illness. And the comorbidities, so again, heart disease, diabetes, COPD, and shortness of breath is one symptom. Hypertension is another. Those are people who might have a higher risk of becoming ill. So I would say that those are people who should probably be more careful about sheltering in place. But overall, I would say we have faced other severe diseases such as every year the flu kills many thousands of people around the world, many more than we've seen from this epidemic. And not to make light of this, but we know that flu does this and worse.
I'd like to add, when we think about other national emergencies, even those that aren't necessarily healthcare related, many of those national emergencies had a specific sort of area of focus or impact, whether that be hurricanes or earthquakes or even world wars. Because in terms of the number of people who had to rise up to answer that call was different in each of those instances. With this particular pandemic, all of us have been called to answer in terms of being responsible and being part of the solution. So I think this is a unique opportunity for us to come together as a country, as a world, in terms of addressing this crisis in a way that is going to be good for all of us.
Let me just add, I would probably say that probably none of us in our professional careers have been through a pandemic like this. And so this is something new that's certainly evolving. I want you to know from a financial standpoint, we are strong and healthy at Stanford Medicine. We have resources that allow us to be able to continue our operations. And there's a reason why we talk about days cash on hand and having some of that extra that is there for reserve. As healthcare employees, we're in a great field because we are needed to be able to address this. And this is something that we'll continue to do. Some of the things that we do on a day-to-day basis, like elective surgeries and that are other aspects of that, they are important to our financial health. And so this will put strains on those reserves in this interim period, but we continue to stay strong. We continue to have employment for our individuals that are part of the healthcare system and in fact are very much needed. My heart certainly goes out to those individuals in the community that will not have that same perspective. And certainly there's ramifications that we'll deal with that probably even for years with the financial challenges. But we continue to stay strong and healthy, and we'll be here to be able to provide the resources that we need to our community.
Great. I'd just like to add that I feel as though I spent several weeks hoping it wasn't going to affect the United States in the same way it did other countries around the world. And I think now the revelation is that it has. And we need to get over the denial and get over the hope that this won't affect us. It has affected us. So it's now time to mount as a community, as healthcare providers, to take the responsibility to do what we need to do to get over this. And we will get over this. Lloyd, why don't you end with closing comments? It seems as though we are close to the end of our time.
Thank you, Andra, and thank you all for joining us today. We look forward to staying in touch. Again, refer to the website that we've set up, and we'll also continue to have these video town hall meetings. Thank you.